These paramedics in southern Lebanon rushed to rescue wounded civilians after an Israeli airstrike. While giving first aid inside this ambulance, a second strike hit them. And then a third. In total, Israel carried out 4 consecutive strikes, 3 hitting ambulances and medical workers. 4 medics were killed and 6 were wounded that day, according to medical sources.
هذا العدو الإسرائيلي شايفنا نحن مسعفين وكان ضارب سيارتين إسعاف ورغم ذلك ما توقف استهداف المدنيين واستهداف المسعفين كمان رجع ضرب علينا مرة ثانية.
Medical workers say it's not just ambulances coming under fire. At least 6 hospitals were damaged and forced to close by nearby strikes, including some supported by Doctors Without Borders, shattered glass and debris, injured staff.
While I was going to the hospital or coming back to the hospital, the strikes were beside us, to the hospital, near to the hospital. The dust and all the explosive, materials entered to our ER.
Since the war between Israel and Iran-backed Hezbollah started in March, the Israeli military has carried out 147 strikes on healthcare workers or facilities in Lebanon, according to the World Health Organization. These attacks have killed at least 100 medics and injured over 200, including teams hit while responding to casualties at the same site.
No healthcare worker should worry about their own life while they try to save the lives of others.
Under international humanitarian law, namely the Geneva Convention, medical personnel and all non-combatants, including wounded or sick enemy fighters, must not be targeted.
At the heart of humanitarian law really is the recognition that enemies in an armed conflict still remain humans on both sides, and that there's no right to kill the enemy. There's a right to put the enemy out of combat. But that's as far as it goes.
But medical workers say they are getting attacked despite identifying themselves.
We put all the logos and all the signs to make sure and to show that we are only medical people trying to help vulnerable population.
Medics and Lebanese officials describe the recent strikes in Fadoum as a quadruple-tap, repeated attacks on the same location, an escalation of the so-called double-tap tactic, targeting rescuers. There is no reliable count of such strikes, as the term is informal and not systematically tracked. Video evidence and witness testimonies suggest Israel deployed double-tap strikes during the 2024 Israel-Hezbollah war. Israel has accused the militant group Hezbollah, as it has Hamas in Gaza, of using hospitals and ambulances as cover for militant activities, a claim denied by Hamas, Hezbollah and the Lebanese health ministry. We asked the Israel Defense Forces for comment. It says it operates in line with international law, granting protection to medical personnel unless they engage in hostile activity. It denies having a policy of double strikes, adding that any follow-up strikes are aimed solely at military targets. The IDF said the reported incident in Fadoum is under review. International humanitarian law experts say whether such repeated strikes are lawful depends on what commanders could reasonably foresee about their consequences.
And when you engage the same target repeatedly within minutes, obviously you will have to expect that there will be wounded people from the previous engagement that will now be targeted, and there will be rescuers on site, there will be neighbors who are trying to rescue their friends, their family members who are getting into the impact areas. There can be situations where you have a military target that is a legitimate military target that is fortified, that needs to be hit several times in order to be neutralized. That exists, and it's not always avoidable that in the process there will be, protected persons that will be hit. It cannot always be realistically avoided, but that's not what we're talking about. The question is whether you systematically implement a method.
From a legal perspective, the key difference depends on the proof of a systematic pattern of unlawful attacks against medical workers. When proven, senior leaders could potentially face prosecution for war crimes in jurisdictions around the world. But since the 1949 Geneva Convention, no government has yet been successfully prosecuted over the deployment of double-tap strikes.
Unfortunately, most armed conflicts are plagued by an absence of accountability. It's been exceedingly rare, even in modern times, that war crimes have been effectively prosecuted. what's really important is that the rule of law is really the only thing that stands between us as a modern society and becoming, again, a Stone Age society that's governed by brute force and blatant violations of humanity.
In the case of first responders, it's not just their safety that's at stake. When ambulances and hospitals get attacked, the ripple effects further harm Lebanon's already fragile medical system.
Medical units are supposed to be the beacons of hope. They are sometimes, especially in places like Lebanon, they are that thin line between life and death. So when an ambulance is affected as a result of the ongoing hostilities, the impact goes beyond this strike that affects the ambulance itself, because that ambulance provides healthcare to tens, if not hundreds and thousands of people within a specific area.
Israel's strikes on Lebanon since early March have killed more than 2,400 people and forced 1.2 million from their homes, according to the International Committee of the Red Cross. Lebanon's healthcare system had already been weakened by the COVID-19 pandemic and a severe socio-economic crisis before the renewed war.
Hospitals are working in extreme strain, and they are facing shortage of medical supplies, intermittent electricity, limited staff capacity, disrupted referral systems.
Despite these conditions, emergency responders continue to show up on the front lines.
People who are in need and who are reaching to us and asking for our help, we cannot leave them behind.